Welcome back to the Mom and Mind podcast. Thank you so much for being here. On today's episode, I'm talking with Tracy Torelli, and we are talking about high functioning and over functioning mothers, what that means, and ways that you can cope differently. I think it's a really useful topic for the listeners, but also for everybody. There's a lot of high functioning and over functioning in society today based on our schedules, based on our pressures. And the more you know about how you are functioning in the world, the more you can do to shift and change that if that's where you're at and that's what you want to do. Tracy has dedicated her career as a therapist to working and focusing on disorders with high relapse rates and risks. Her expertise in working with severe and persistently mentally ill individuals has really shaped her approach, emphasizing resilience and failing well as pathways to growth and healing. She's worked most recently as a clinical staff educator for an outpatient clinic at St. Joseph's Hospital Health Center, and for the past 15 years has dedicated significant time to training therapists, has contributed to various boards, and now her passion lies in women's mental health, reproductive mental health, and to really focus her holistic approach to mental health care and advocacy for the comprehensive well being of others. So let's dive in and meet Tracy. Welcome, Tracy. Thanks for being here.
Oh, thank you so much for having me. I'm really excited.
Yeah, me too. I'm for multiple reasons I'm excited, but I think what we're going to talk about today, what you want to talk about today, is really an important part of uh, the mental health of new parents, new moms, just like the pressures that they have. Um, and I think you have some really good, actionable, usable ways to process through all of that and to make things easier for people. But first, I would love to know how you got into this specialty and what brought you to this.
Oh yeah. So I got into this I just became interested in working with women in the perinatal period. I had been working in an agency for over a decade, and the agency specialized in more of the severe and persistently mentally ill people who are struggling with homicidal or suicidal issues. And I ended up with a patient who got discharged from an inpatient unit. And she had been hospitalized for 2 weeks. And she'd been hospitalized because people thought she was a danger to her child. And so, in the first 20 minutes of meeting this woman who had a discharge plan of had to be supervised with her child who was, like 3 weeks old, I just had this gut sense that I would give her my child right away. I felt like she was totally safe. And the more that I talked to her, the more that she sounded like she had a similar dilemma as some other patients that I had encountered, where she had intrusive thoughts, but the thoughts were very distressing. And I didn't really know what that was. I started to question myself, like, do I know what I'm doing? I really feel like this woman would be safe for her child. These thoughts are very distressing. It really reminds me of some of the patients that I worked with who had intrusive thoughts to harm themselves, and it alarmed them. And it just happened that I mentioned this to someone, and they alerted me to the diagnosis of postpartum OCD. And I looked into that, and I cannot tell you how upset I was that this woman was hospitalized
Mm,
away from her baby for 2 weeks because she went to go get help.
mhm,
She was having intrusive thoughts of, her harming her baby, and they were a nightmare. And she went to these providers, and the providers said, "Oh yeah, your thoughts are right. You're not right, but your thoughts are right." And they really messed with her sense of self and being able to be confident in herself. And it just kind of pushed a button with me, and I just decided, no more. This is not
Good.
going to happen ever again. And it did. I watched it happen again in another circumstance, but it really put me on this path of trying to establish better assessment and care for moms in really vulnerable spots. And so while I was still at the agency, I worked on obtaining grants to get people trained
Nice.
in this by Postpartum Support International. Um, we got 40 providers, prescribers,
Amazing.
therapists, RNs. Yeah, it was great. I just felt so much more comfortable
Hmm.
sending patients I was working with to the psychiatric emergency room that was part of my organization. And since leaving the agency in COVID, I opened up my private practice, and my interest just hasn't stopped.
Yeah.
And so I guess that's where I am now.
Yeah.
Is
Yeah.
I'm
Yeah.
still trying to, right wrongs.
Great. It's so needed. You're right. It does still happen that way, but it's because it's so misunderstood. It's
Mhm.
really, really misunderstood. And a secondary effect of what happened to that woman is, oh, I don't know if she felt that it was traumatizing for her, but there is like insult to injury, or injury to insult, from like a double whammy, trying to go to get help and people having you can not believe in yourself and question yourself and have to deal with that separation. It's just horrible.
Yeah, it really was. It traumatized her, it traumatized the family, and the thing that was most distressing is that she she didn't know to be mad about that
Mm,
something wrong had happened, and
mhm,
she
mhm,
she believed it. And so we had to unravel so much wariness and suspiciousness of self. And I had to, you know, go against what physicians, people who very much outrank me, with their discharge plan, and do it step by step without, having good education in the field. So it was a really hard process, but
mhm,
she got through it. She's so tough. She ended up having another baby after that. So that had been her second. She had a third baby,
mhm,
and like trauma does, it came back up, but she got through that, and it didn't happen again. And she knew what to look for, and
mhm,
she was on medication at the time,
mhm.
um, and enjoyed that postpartum period much more
It's so
than.
good when you can like have a healing experience after
Yes.
something
Yeah.
like that.
Yep. Yep. It was great. She did a great job.
Yeah. So, okay. So, a lot of the people you're supporting in your practice and helping are dealing with high levels of anxiety, mm, perinatal anxiety, perinatal OCD.
Yes. I really like to work on disorders that have to do with anxiety. So I end up with, I'd say about, 80% of my practice is moms. Maybe 40% I got in the perinatal period.
Hmm.
Um, and maybe 90% of those have anxiety as a primary presentation. So that's a real interest of mine, um, is how to approach people who are high functioning, very
Mm,
intelligent, very bright, very hardworking, who have this monkey on their back that never gives them a break. Always feels like
mm,
there's, a corner to turn. If I can just kind of get through this, if I can get through this, then I'm going to be okay. But you find out you're in a round room.
mm.
And so that's, anxiety has always been a really big interest for me. And then, working on it with mothers and high functioning individuals is, most of how I spend my time.
Yeah. Can you, for people who might not understand what the like high functioning means or what it can mean for somebody, like what does that look like? What is somebody experiencing who's kind of high functioning or over functioning?
Yeah, so as a reference, I worked in the agency where most people have never had and will never have a full time job. And so that is a level of functioning that they worked very hard for and they should be proud of. And when we're talking about higher functioning, we're talking about where, from my perspective, it's where people their lives don't even look good on paper in terms of the demands and the responsibility
Mm,
and time. So, there's some statistics that you can think about for high functioning individuals. I think one statistic I read was like less than 2% of the world's population can complete an undergraduate degree. So I would consider anybody who's been successful in any level of college would be then an over functioning person, like
mm,
more than most of the world's population. But anybody who's doing more role than just one, like this, I'm just working, or I am a stay-at-home mom, but I'm also managing a household. Like once you start to add up the roles, I think about
mm,
things like high functioning, over functioning, and it
mhm.
doesn't mean it's bad. It doesn't mean you're doing anything wrong, but it just
Right.
means that you really are. Um, it really is impossible to do that as if it's your full-time job. All of those roles.
Oh, right. Okay. This is like more than a full plate, doing a lot. Um, and to whatever degree you are able to do that, I assume depends on like how you are doing. If you can,
Yeah.
but like if you also are dealing with a lot of anxiety or depression and still having to push through and do all of those things, that's going to obviously feel a lot harder and maybe even not possible at times.
Yeah, yeah, and just that hamster wheel of figuring out whether the priorities are for today because you have to let some go. So you have to like that decision making is constant because you can't do everything. So you have to figure out what you are going to do, and you usually people don't let those things go that have to take the back seat, kind of cross their fingers, and then they beat themselves up about it later as if they had lots of time. So,
Oh,
yeah, just a lot of roles, including the management of
mhm.
all of those roles.
That's interesting. That what you were saying that they beat themselves. Not that that's interesting that they beat themselves up, but the idea that they have more time, um, or than they either think they do, or that they're trying to put a lot of stuff into a limited amount of time. Is it that like, or do you find that people think they can or should be able to do a lot more than they can?
I think they have 2 conversations with themselves and they forget to connect them. So they
Mm,
make a really good call in terms of priority. What am I gonna prioritize in the day?
mm,
And then when they review the stuff that wasn't done, um, they have, like, a separate conversation with themselves, and ask and the question gets really oversimplified,
mm.
like, "Did I not do it? No, I didn't do it, so I'm a bad guy."
Oh,
And it doesn't get put into context of that you made a really good call in terms of priority. You
mm,
did a wise thing
mhm,
there.
mhm,
Um, and but the loop will just be, well, I didn't do it, so that's bad. And I'm probably bad because I didn't do it, even though like all of this stuff got done.
mhm. Lots and
So
lots of things. Yeah.
yeah, yeah. So it's hard. So it's like disconnecting the feelings you have about not doing what you didn't do.
Mhm,
And if we could just connect that and say, like, I made a really good call about what I did today. I actually prioritized things really wisely in a safe way. And it still hurts my feelings that I didn't do all the things that I wanted to do, or I wasn't able to go after this role or go after this activity in a way that would have finished it up or made me feel accomplished. So, not having that and sentence in there, I think is a pattern that I see with
right.
people are high functioning and over functioning.
I guess the challenge with that is, have you ever seen anybody finish that list?
No, and nor should they.
Mm. Right, 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 right. Okay, so like unreasonable expectations of themselves, like too much pressure. Um,
Yeah, I think it's the unrealistic and also just not trusting themselves that over time, the priorities will evolve,
Mm,
and, um, and that's what we want, our kids to see. We want our kids to see that it is okay to make decisions about how we spend our moments on this earth, and even if they're wise decisions, that we can still spend a little bit of time, um, responding to how it feels to not do everything we want to do.
mm. That
And that if they can do that, if you can, if you can like respond and hold how it feels to disappoint yourself or to be disappointed,
mm,
then that's a much more sturdy place than if you can burn the candles on both ends and get everything on that to-do list done.
every day, forever. That's
I
what it
Yeah,
could feel
it's
like.
like, yeah, it's just the round room. Like if I
Yeah.
can just get this project done, like that sort of thing. And you can tell yourself the truth. I think a lot of people that I speak to try to talk themselves out of wanting to do the whole to-do list. I shouldn't even care about that. I shouldn't. And instead, I think it can be much more helpful to encourage. I try to encourage people to trust yourself and say, "Yeah, I do have an opinion about that. Actually really wanted to do that," or "I wish that that had gotten done," or "I feel kind of yucky that that didn't get done."
Mm,
And not being afraid of those feelings, not feeling like you have to talk yourself out of those feelings and justify that you did the right thing, and
mm,
instead say, "I made a call. I know why I made that call. I understand why I made that call." And it wasn't because I was devaluing anything. Didn't mean that I was being lazy. It just meant that I took the best shot I could. I still have some feelings about how it went, um, but I can live through that. Like, I can get through how it feels to make a call, a good one,
mhm.
and still have some bummer feelings about it and not try to talk my like, well, at least, sometimes people will say.
That is such an important point and, I guess, lesson or support for people because I hear that a lot, that, almost like trying to smooth something over and tell yourself you shouldn't have feelings about something when you do.
Yeah,
But you're
yeah.
talking about like the you can have feelings about it, that okay, you didn't take care of that task you wish you could have, would have. Um, and that somewhere in there there's, I don't know, what are you wanting people to do, like with the both and, like, yeah, you can be upset about that feeling, and
Whatever statement rings a bell. So for
mhm,
some people, it's, I trust that I'm really thorough when I make
mm,
decisions.
mm,
So, um, in that's important to say because some of that negative loop on the other side is, could be that that person calls themselves careless or calls themselves like you don't try hard enough. So
mm,
I think the first statement is telling yourself the truth
mhm,
about the call,
mm,
and I'm really thorough, or I didn't have a lot of time to make a decision, or this felt a lot like a decision I've had to make before, and so I kind of like mimicked that.
mhm,
Um, and um, and you could say, and it was actually like the wrong decision, and that's okay to say that I don't like, I don't want to do that again. But
right,
at least you can say, you can, tell yourself the truth about it, on that respects on how seriously you take these decisions. So, when it comes to the postpartum period, I think about moms making decisions about, um, like breastfeeding, formula, um, tummy time,
mm,
sleep training, things like
mhm,
that. And I mean, you're doing so much. you're making the best call you can. It's okay to tell yourself the truth that there is an ideal or a fantasy that you are looking forward to and that you can have some feelings about. You have feelings about that.
Mhm.
And instead of getting rid of those feelings, instead of like, if you had a really strong hope to breastfeed for a certain amount of time, and instead of trying to get yourself to, you know, to glorify formula, you can say, I am a really thorough mom. And um, I also, you know, um, wished that I could have breastfed for another 6 months.
Mhm.
And I can get through those feelings.
That last, I mean, all three of those, the parts of that, um, are so important, and I think that the last piece, um, is what is missing, um, more, eh, let me rephrase that. The last piece of that, which, like, kinda trying to tolerate the distress of, like, that I can get through those feelings,
Mhm.
is so important because a lot of people don't get to that. Like, if they're stuck in the loop, there's
Yeah.
they're not ever able to get to that feeling of like, okay, yeah, I can get through this.
Yeah. Yeah. Like, women will, who look back and they say, "Oh my god, I wish I had done this earlier."
Mm,
If often when I really get into, so how were you making decisions at that time? What was it like to make a decision at that time? It's often because the mom is worried about how it was going to feel to make a decision that she wanted to make. And very often, there's so many people who weigh in on parenting. And so they'll imagine like a jury of people who will, come up with all the reasons why she didn't have a right to make that decision, or
mm,
why, I think for moms, there's often a sentence, if I can, then I should.
ooh,
And, we talk about that a lot. And I say, well, actually, I think that that leads you to saying things like, I can't. And instead, I would rather you say, I actually could. I actually could burn myself out for an undetermined amount of time because I actually don't know my limit yet.
mm,
But um, even though I can, it doesn't mean it's a good idea. Or even though I can, doesn't mean I want to, which is a
right.
much stronger stance. And it reinforces that you know yourself and you feel like yourself in this. And trying to help women detect that feeling of when they're stressed about making a decision, and instead of saying, you're anxious, or like you have trouble making decisions, trying to help them identify that, that's the feeling that you're worried about having when you make the decision that you want to make.
Mm,
Probably when you have that feeling, it's because you're doing something that you need a break from, or you need to know how you're going to get out of it. And and being able to say to yourself, I can get through this feeling because I'm feeling it right now. Nothing new is going to happen when I make this decision, because I'm kind of like, I'm like vaccinated against it right now because I'm already in it. And if we said, no, that's not a bad feeling, you don't have to prove anything right or wrong, and you just have to ask yourself things like, what do I want to try next?
mm,
And what do I want to try next, and for how long? And then I'm going to put a date in my phone and say, do I still want to do this? So you don't feel like you have to come up with the right next decision. You just have to feel like you want to come up with a decision. Like getting off the fence can settle down that anxiety and uh, give you opportunity to make a plan for, how am I going to cope with the feelings that become intrusive and that haunt me, and how can I, you know, gather some information, gather some data so that I can think about this decision again in the future. So
that takes
we,
so much pressure off. I like, if you can really get to a place where you can allow yourself that flexibility and almost like permission to experiment,
mhm.
a little bit, how much. You might still have some anxiety floating around and some worry floating around, but without as much pressure at least.
Yeah, yeah. And um, what this just kind of remind me of something that one of the things that what moms just don't want to be is wrong. But one thing that we talk about to just kind of settle down that worry is just talking about how we're wrong probably 10 times before 9 in the morning. Like people who are higher functioning, over functioning are actually experts at failure.
Mm,
So if we can transfer some of that um, confidence and confidence with saying, I've actually failed 6 trillion times in my life, and so if I fail one more time here, I can get through it just because I've gotten through it before. And then we can get into that conversation of, you know, what is the catastrophe as you fail? And something I had said to you earlier was, we talk about things like, so what if you, I don't know, breastfeeding is such an easy topic to talk about because
sure.
it is such a hot topic. So,
Yeah.
so what if you stopped breastfeeding 2 months earlier than you could have? Like you could have like power pumped, and that sort of stuff. So, you know, if you line up 10 40-year-olds, would you be able to tell me whose mom stopped 2 months early?
Mm,
Or if you lined up 10 40-year-olds, can you tell me which mom, waited a month to do the sleep training that, she didn't want to do, or who did baby led weaning, or who did whatever.
right.
And so settling some of that down too, because I think a lot of times women worry about the admission of what they're doing. They're like, oh my God, I can't tell the doctor that I'm doing this, or they're gonna, like I've got to tell them that I haven't done tummy time. And we kind of like walk that back and say, you can help the doctor understand what your life is, and only work with providers who are interested in that.
Mm.
But unless that doctor is going to come over and sleep train your baby, you can fire them. You can say, no, you are
Mhm.
not going to make me oversimplify my life to one decision. And
Right.
um, I actually got that from our primary care. He's great and he's funny. He says, I don't care how you feed your baby because
Mhm.
100% of babies die if they don't eat.
Mm,
If your baby's alive, then I'm really proud of you.
mm.
And he said, I don't, he goes, I was formula fed, can't be that bad, So he's been
Yeah.
around long enough where
Uh-huh.
he says, I'm gonna back you on what your goals are. I'm gonna help you troubleshoot, but I'm gonna talk you out of rigidity
Mm.
from the front end.
Oh, that's
He's
fantastic. I wish all, healthcare providers could have that kind of flexibility. All people,
yeah,
really. I mean, there's
yeah.
so much pressure, and a lot of what they have the internalized pressure that you're talking about. People are dealing with in their own thought process. It's almost like fear of getting in trouble in some way, like the moms who we're talking about primarily having this pressure to do the right thing and do things perfectly, know all the answers. Like, what happens if you don't do that? If you don't do it perfectly, if you don't have the answers, it's like there's a fear there that
Mhm.
they'll get in trouble or something bad will happen, or that I don't know. It could be any number of things, but what if we could just be more flexible with ourselves?
Yeah, yeah. Or it's, I think a lot of the moms that I work with, they worry that it's evidence that being a mom or their kids aren't a priority.
Hmm.
If they don't come up with the right answer, or if they don't sacrifice themselves to do what a provider told them to do,
Oh, right.
um,
Right.
they obviously aren't trying hard enough, or that it, that is the moment in time where people are allowed to evaluate whether or not they are a dedicated mom. And um and you know I hear about some of the interactions that people have had with providers, and I understand why that happens in some of the
Right.
propaganda that goes out, and I understand that, and I know that these organizations and these providers are trying to have the right thing happen for kids. But every time I review the research, I'm guessing when you review the research, there's, you know, when moms are not doing well, kids are affected.
Mhm.
But, we don't have a separate NICU for kids who are breastfed and formula fed. We don't have a separate, kids don't get automatically referred to PT if they don't have a certain number of minutes of tummy time. And guess
Mhm.
what? Even if you breastfeed your child, you might end up in the hospital. Even if you do tummy time, your kid might need PT.
Mhm.
So
Mhm. Mhm.
we take these like things that are helpful to know in understanding babies and development, and turn them into these very simple um, rules for moms.
Mhm.
And one of the things that I loved when um, I was reading um, this report that came from the American Obstetrics Association, and they referenced that. They said, guess what? The risk of SIDS is so low. But so, that's we can't really we cannot give moms rules on sleeping in the room with the baby if the mom can't sleep, because the risk of SIDS is so low, and the risk, if a mom isn't able to sleep with the baby in the room, the risk for postpartum mood disorders is so high. So the
Mhm.
American Obstetric Association said, actually, we're going to follow the research on whatever way mom can sleep, that's where the baby is.
Mm.
That's it. And we're not going to haunt moms about SIDS. We're just going to tell moms to sleep because the outcomes are way better. I
Right.
was really excited when I read that. I was like, "Oh my god, you're saying the right things." I mean, I was the postpartum period. Even though I treated it, I was like, "Oh, I'm not going to have any postpartum." I had postpartum OCD.
Mhm.
I had postpartum anxiety. Luckily, I was, ready for it, but I wasn't ready for it. And so
Right.
I
Right.
was
I know what you mean.
told myself I was going to handle things in stride, and then I was haunted by SIDS.
Mhm.
So it doesn't mean, I don't know. Knowing this information doesn't mean it's perfect, but luckily I had people around me to help me have these conversations, and didn't set a line in the sand that I needed to get rid of these symptoms or these thoughts in order for me to get better. I had people around me who said I can get through having this stuff, and I can trust myself to make good decisions about a parent. That those are different.
Yeah, I mean, I totally agree with you. And when people are in the thick of this, it's really hard
Mhm.
to get to that, like to be able to make that distinction themselves. Which I just think is like the one of the beauties of therapy with a specialist, somebody who like and who really gets it, um, can highlight that for you or kind of show you that there's a different way of thinking and there's a different way of walking through these pressures and the anxiety so that you can give yourself a break eventually.
Yeah, yeah, and separate yourself from them. I use a lot of analogies around like physical stuff, like these loops are like Charlie horses.
Mm.
It doesn't mean there's something wrong with your body. You can't
Mhm.
really function. You don't call 911, but you're
Mhm.
not really responsible for getting rid of them. So you just kind of like you get through the Charlie horse. And then you can go back to regular functioning.
Mhm.
So even just having some women use different language to transfer physical language over to this stuff, like I'm Charlie horsing,
Mhm.
or my like my brain is like sore today,
Mhm.
things like that. And then it starts to give them a little bit of a break between how they're feeling and who they are. So we can, we if someone's having a Charlie horse, we just like deal with the Charlie horse, and then we make decisions when they're not a Charlie horse. So um, uh, just being able to take care of their brain in the same way they learn to take care of their body.
It's so much easier to apply it when you think about it in those terms.
Yeah, for sure. Yep, and
Mm.
then you're not responsible for getting rid of it. It happens to everybody. You can say you're someone, "I'm Charlie horsing," and that person's not trying to talk you out of the worries that you're having. They're like,
Oh my
"Oh, yeah, those
gosh.
are all normal." Like, whenever you Charlie horse, you always freak out about SIDS. That's, like, your Charlie horse, for
Mhm.
sure. It's
Mhm.
okay, like, you're gonna get through it. Every time it's gone away, this is really familiar to you. Maybe it's the 200th time you've Charlie horsed, whatever.
Right, which also, I mean, the thing that often, is especially with OCD, let's say, you fear something and then you avoid it because you don't want to have, obviously, you want to avoid the thing you're fearing.
Mhm.
But what you're describing is helping people remember that they can get through it. They can tolerate the distress of moving through this and that it's temporary. So, like,
Yeah.
the avoidance doesn't become as necessary because you know that whatever it is going to come and go.
Right, and it's gonna go away whether you avoid it or not. Whether you OCD isn't looking to be isn't looking to go away. So, if you are having an intrusive obsessive experience and being able to say, OCD is telling you it's not gonna go away unless you follow the rules, like research or
Mm,
whatever. And you'd say, well, you actually make really good decisions about this topic when you're not Charlie horsing.
mm,
And you are Charlie horsing, and whether you follow the rules or not, it's going to go away. So let's kind of deal with the panic attack that you're having right now. It probably is going to stick around longer because you're not following its rules.
mm,
But um, you also know that it's not going away anyway. So you're not saving yourself too much. So then they don't have to feel like they white knuckle it. And then whenever I have a mother with postpartum OCD, when they leave the office, and I say, and you know what, if you follow the rules, no big deal. Like,
mhm,
you like follow the rules for OCD one more time. It's not like it, pays the mortgage. So it's not going to stay. Do your best if you're sleep deprived and you like do the ritual. Okay. Can you have your spouse do the ritual for you so that you can sleep, and maybe they can do the checking or maybe they can do the cleaning and, that sort of stuff. But, it's a temporary resident in your brain.
mhm.
So,
No,
just trying to shake it up a little.
yeah, I mean, these are really good strategies for coping, and tolerating that overwhelm and being able to, I mean, but you can rely on a skill or a tool like this to get you through in a lot of ways. I mean, people need to know that they're going to be okay. That's just like a fundamental need. And when you're in, anxiety land, it's hard to remember that.
Mhm. Yeah. And when you're in anxiety land, I think the saddest part is people who have lost themselves and they start to call themselves anxious, even though they would never encourage anybody else to panic like that or to
Mm,
follow rules. So I think helping people get back to who they are, you know, yourself is different from your symptoms.
mhm,
And so Charlie horses don't, you don't end up getting like a disability sticker for your car if you have Charlie horses, because it doesn't mean that there's something wrong with you. It means that you're having Charlie horses and sometimes you can't walk.
mhm,
So helping, like reassuring people that the very reason that they're distressed about what they're going through is evidence that it's not who they are. It's only if what you're thinking about is something that you would teach your kid or teach your sister or teach any other new mom to do, then that's different. So you can have symptoms all the time, but it still doesn't mean it's made you a different person. It
mhm.
just means you have symptoms right now.
Sure.
So I just try to tease. I think about things visually all the time, and I just keep trying to untangle stuff from the sense of self, so
Yeah.
that people can be in the car and say, I hate OCD, but they don't treat it like they're allergic to it,
Mhm. Mhm.
settling down the distress.
Right. I mean, that's really powerful. Saying I am experiencing anxiety versus I am anxious.
Hmm.
Like at making it a personality trait. Um,
Hmm.
um, is it can make it harder to get through it. Well, I really appreciate this discussion, in particular because I think there are things that you talked about that are really usable for a lot of the people who are listening. It is anxiety is tough. It's hard. Being dealing with your high functioning self is difficult in the postpartum period or pregnancy or whatever it is that you're in during that time, um, and people are searching for things to hold on to, skills and tools that they can use. And I think you've really brought that today. So thank you.
Oh, thanks for having me. I really enjoyed the discussion.
Thanks for being here. If you'd like to get connected with Tracy, you can go to her website, claritytherapycny.com. And please do share this episode with somebody who you know could benefit from learning a little bit more about high functioning and over functioning. As I said before, this is something that we all do to some extent. And more so, moms who are transitioning into the role of mother and trying to learn how to balance all that they used to do with all that they are doing now, and really might need a new way or a different way to approach how they're functioning in their day to day life and what they can do differently about that. I thank you all for joining me today. Until next time.